Long story short, that same lady who hadn't opened her eyes in almost 3 to 4 weeks when I started Prestige, who was yelling out, not functioning, couldn't even tell me her name, ended up being transferred from the dementia unit to the high-functioning geriatric unit. She did have Alzheimer's, but it was early. She ended up playing Scrabble. She ended up playing bingo. She was this wonderful 89-year-old lady who was smiling, laughing, and interacting with everybody. And the problem had been that her brain energy was extremely low and nobody wanted to treat it. Welcome to alzheimersmd.org. Sally, I'd like to call her a miracle, but she really wasn't a miracle, but she did have tremendous benefits from my unique approach to dementia and Alzheimer's disease. Hi, I'm William A. Van Horn, MD. I'm a medical doctor who spent the last 20 years of my life helping individuals and families with all levels of memory loss, including advanced Alzheimer's disease, and seeing significant benefits in a world that tells you there's nothing you can do about Alzheimer's. Sally was very special to me. I've never seen someone before or after, and I've seen a lot of patients with dementia. She came into the hospital. She's 89 years old, African-American woman, grew up in the South. And what was really unique about her, I remember distinctly, is that I'd never seen her eyes except when I forcefully lifted up her lids, and this went on for several weeks. The reason she got in the hospital is she'd been kicked out of multiple nursing homes, multiple assisted livings, because she got very paranoid, would scream out, would physically attack and verbally attack the staff. And obviously you can't stay there, and this happens with a lot of dementia patients. I'm one of the few doctors in this country who run Alzheimer's units, where patients come in from nursing homes, from home, who are out of control because they've started losing the front of the brain, which is the part of the brain that we control our emotions with. And Sally came in very bad shape. She just laid there like this, eyes closed, and screamed out that she was hearing people outside killing her children and hanging her sons. I tried my typical medications, and if you've been listening to my broad podcast, the brain is a network of wires going everywhere, and there's multiple neural networks. And I use the analogy, it's like a boat that's sinking, and there's multiple holes in the bottom of the boat. And most doctors either address one hole, these are doctors in my field, or they don't address any holes. Well, my approach is to use very safe medicines known to be beneficial to the brain to address each hole, to boost the neural networks in the brain, to boost the neurotransmitter in the brain, to bring the brain back to life to some degree, and block the holes so the boat stops sinking. And I did that with Sally. I got her on my medicines, group of medicines, and nothing happened. So I'm 3 weeks into it. Normally Medicare allows me about 10 days. Well, I've already asked for extended time because she's just there. She's not doing anything, and she's still screaming out some. And I was sitting down with my treatment team, with our social worker, the nurses, and I said, you know, if Sally leaves like this, she's dead. It's just they're going to have to put her on like Ativan or some kind of medicine that sedates her, and she'll just lay there until she has a heart attack or a blood clot or something and dies. And I said, so why not try something that might work that's a little bit outside the box? So I did. I tried her on what was a new medicine back then, about 10, 15 years ago. It was called Prestige. And to this day, it's the most activating medicine for the brain that I've ever used. And one of the problems with the medicines for the brain is we label them with psychological terms. Well, people like Sally didn't have psychological issues. She wasn't emotionally depressed. She wasn't emotionally anxious. Her brain was all chemically out of whack. And consequently, she was feeling terrible all the time. So I prefer neurotransmitter medications, neurotransmitter boosters, neurotransmitter lowers, whatever you want to call them. I prefer focusing on the neurotransmitters. So Prestige is a medicine that raises norepinephrine, which is neurotransmitter, serotonin, which is a neurotransmitter, and dopamine, all critical to the health of the brain and the function of the brain and the experience and quality of life. So I decided to put her on that medication, because I knew it was very activating. I knew it was stronger than most of the neurotransmitter boosters that we had come out or the antidepressants that had come out. And I wasn't treating her for depression. I was treating her for low neurotransmitters in the brain. The other thing I did that was very unique is that if I have a 40-year-old come to me who's not getting out of bed because they're so tired and I put them on Prestige, the average dose is usually about 200 milligrams. Part of that is because their brain has a lot of neurotransmitters, and I'm just boosting the ones they already have. Well, with advanced Alzheimer's patients, I'm convinced their neurotransmitter systems are so broken down, they almost have very few neurotransmitters. So they actually seem to need more neurotransmitter boost than a 40-year-old, which makes logical sense. However, most doctors believe they should get old people less medicine because their kidneys and their liver don't eliminate them as quickly. So therefore, I find that many patients with dementia and Alzheimer's disease, especially advanced stage, are way under-medicated with neurotransmitter boosters. So you'll find them on a little bit and they say it doesn't work. Well, it doesn't work because it's not enough. So I find they even need more. So what I did with Sally was I started her on 50 milligrams of Prestige, took her to 100 after a few days. 100 was the maximum approved by the FDA, but it was tested to 600, shown to be safe. And over 3 weeks, I got her to a dose of 400, which is a lot of Prestige for even a younger person, but it's really considered a lot for 89 years old. But every day I saw her, I followed her for side effects, and I know what the typical side effects are for Prestige. She wasn't getting any of them, so she was tolerating it fine. So I just kept going up, waiting for her to have not tolerated it, then I was going to lower it. Didn't have to do that. She got to 400. Long story short, that same lady who hadn't opened her eyes in almost 3 to 4 weeks when I started Prestige, who was yelling out, not functioning, couldn't even tell me her name, ended up being transferred from the dementia unit to the high-functioning geriatric unit. She did have Alzheimer's, but it was early. She ended up playing Scrabble. She ended up playing bingo. She was this wonderful 89-year-old lady who was smiling, laughing, and interacting with everybody. And the problem had been that her brain energy was extremely low and nobody wanted to treat it. What's the point of that story? Is that neurotransmitter boosters, brain energy medicines are critical to the treatment of all levels of memory loss, particularly advanced dementia. And I believe every patient with dementia should be on one. Thank you for joining alzheimersmd.org, the place where you learn how to prevent Alzheimer's, slow down memory loss, and bring back quality of life to advanced Alzheimer's patients. We have an exciting new guide that summarizes my approach, my medical approach to Alzheimer's disease, showing what medications are bad for your brain, that accelerate memory loss, showing medicines what are good for your brain. Download it now.